Digital acceleration is here. Health systems are walking the path, but are they in the right direction? Welcome to Patient Journey Pioneers, roadmaps from the top digital leaders in healthcare, who share insights and strategies that are pushing the patient journey to new heights. This podcast is brought to you by Hyro, and I'm your host, Liat Kosuch. Welcome to another episode of Patient Journey Pioneers. Today's pioneer is Gretchen Britt, Vice President, Information Technology at Liberty Hospital. Gretchen, thanks for hopping on the pod.
Thanks for having me. I'm excited to be here.
I know you hung out with our VP Marketing, Erin, at Vive at our booth, right?
I did. We first met at the street party where I kind of latched onto that group and got to know who they were and about Hyro. And then I then later crashed their party that they had. I can't remember where it was even at that night. It was a very good night. We had a great time. So crashed that party, hung out with them again, and then popped in at the Hyro booth and actually sat in and got to hear what it was all about. And it was very exciting and have reconnected since then. So yeah.
Yay. Amazing. Yeah, I think it was the healthcare honky tonk where
Yes,
we had like
it was. I believe that's right. Yeah.
Yeah, there was so much going on. So it's cool that you remember that.
Yeah.
And so before we dive into questions and kind of get to know you better and your journey, et cetera, how was your experience at Vive? Like what stood out to you in particular as far as trends, especially as someone in your role? How was it?
So for me, being early in my role, it's all about the growth and the leadership. One, I love to see what new technology is out there. It's so exciting right now. So that was really cool to see all the different booths because it was truly my first Vive. But I really take enjoyment, satisfaction from the learning opportunities, the leadership opportunities, the storytelling, hearing what others have done. I think anytime we tell our stories, that helps others to learn. So I'm always happy to hear what others have done that have walked the path before me.
So any trends that like you saw kind of over and over again in 2023 Vive, something that you noticed that kind of took front stage?
Yeah, Chat GPT and AI, of course. I think that was everywhere. Everywhere you went, you're hearing about it. What's new? What's coming? What are we going to attempt to do in healthcare? How much are we going to trust it? It's still very early and very new, and I think can be frightening to some. So I think we have to be careful with what we do and how we roll it out and just be diligent and ensure that we roll it out the right way.
Yeah, I think in healthcare, especially with, protocol, privacy, and everything that comes with healthcare, it's a bit more challenging to just roll it out.
Exactly. Very true.
Okay, so Gretchen, let's dive into your background. You started in healthcare right out of high school as a certified nurse's aide, but went through a whole journey in healthcare since for over 25 years. So this May will actually mark 20 years as a registered nurse, but walk us briefly through your timeline and kind of where you are today.
Yeah, absolutely. So, started right out of high school. I got a certified nurse's aide in high school. It was a great program that I absolutely loved. And I found this love of caring for others and a passion for it. So I started as a nurse's aide. I worked at a very small hospital. So the beauty of that is that in a small hospital, if you're ambitious and you prove your worth, they'll teach you to do fun things. So I got to learn how to scrub in the operating room, and that opened my eyes to a whole new world. Passing instruments, assisting, helping save lives, taking call, all of that fun stuff. So I then went to nursing school, graduated, like you said, 20 years ago, dating myself for sure. And I began my career, what I thought was going to be in the operating room. I was actually offered a position here at Liberty Hospital as a new grad in the operating room, and as well as the NICU, a level 2 neonatal intensive care unit. So I knew I loved the operating room, right? And was excited for the opportunity to work in the operating room. But I really was intrigued in this pull to babies and being able to take care of our tiniest patients. So I went in completely green and started in the NICU as a new grad nurse doing level 2 NICU care. That also includes stabilization transfer to a level 3 tertiary center. And I also did mother baby, caring for moms and babies. It was amazing, but what I lacked, I thought, was I really wanted some more critical care experience. So I went to Children's Mercy, which is our local children's hospital here in Kansas City area, And I went down there. I thought, where can I get some great critical care experience? That was the spot. I joined the open heart surgery team. I worked open hearts for a couple of years and
Wow.
gained yeah, vast experience. Became more comfortable as a nurse with my skills, being able to be a leader, to take charge. I think all of that comes with time as a nurse. Um, and then I joined the trauma team. So I started doing trauma call. And unfortunately, that's where you see the worst of the worst. You get to save lives, though. And it was an amazing opportunity. And it taught me skills that I will take with me forever. But at one point, I really missed taking care of those new babies, new mamas. In a level two NICU, you dealt with some very complex, difficult situations, but you also got to have that bonding, that education, and that opportunity with new parents that was just amazing. So I came back to Liberty in 2008 and went back to the NICU. And at that point, I kind of started my journey. I was at the bedside for years, and then I started kind of seeing what leadership opportunities were out there. And being a leader in the NICU, it opened the door to informatics, right? So any project that was out there, anything that I could get my hands on, I would volunteer. I want to be the super user. I want to train. I want to help with this. This is so cool. It just blew my mind, all the opportunities that were out there for a nurse. So 2017, an opportunity came. It was for a role, it was a new role that was called a physician support coordinator. And this physician support coordinator was supposed to be to take care of just your physician training in the EMR. Well, I got to make it my own. I became the go-to troubleshooting person for anything tech, anything they touched. I learned how to fix it for them, how I could help them quickly resolve their issues, as well as doing their training. And before long, I started doing configurations and running my own projects. So fast forward, I worked my way up, and today I am the IT leader for the entire organization. So it's been a fun,
Wow.
fast journey.
Not a small role, what you
No,
landed at.
no, no, not at all.
So you mainly worked with the epics
No,
of systems.
yeah, not Epic. We are the Allscripts now Altera platform, so Sunrise.
Okay.
So yeah, I think
Right.
being a previous end user and understanding the software. Of course, when I was at Children's Mercy, we were on Cerner, and I did
Mhm.
help with that build of the CB surgery team, building our templates, building each case out, that sort of thing. So that was actually my first taste many, many years ago. Yeah.
So, okay, after having gone through that journey from bedside to informatics, what are 2 to 3 of your biggest takeaways from that?
I think the biggest thing, being a nurse, being a leader, it's the computer's the problem, right? It's always the tech is the problem. We always feel that the tech is the issue. So I think the biggest tech takeaway was it's not always the tech, right? It's not always changing to something new or buying a new product that is the solution. That you truly have to understand, one, what is the issue, and two, what are we trying to accomplish? What is our goal? Then you need to understand, what is the workflow, right? Is it a people issue? Is it a process issue? Or is it truly the tech that's the issue? And I think being the nurse on one side, you always just think, well, it can't be us, right? It can't be our people or our process. So I think that was a big eye opener for me in the role of an analyst, and learning that there's more to it. It's not just implementing a new product. It's not just implementing a new workflow. You have to understand what you're truly trying to accomplish and make sure that you're fixing or tweaking the right thing. Maybe it's a policy, maybe it's a process that needs to be tweaked. Maybe you need to deal with a certain group of people doing something that is inappropriate and causing the issue. I think workflow would be my number two. Workflow is key. So having those stakeholders at the table, making sure that you have the right people involved, and this is probably basic, right? Everybody hears this, but when you don't, that's where you don't find success. You need to make sure that you have everyone at the table, everyone is contributing in the right way, and we all come up with a solution together. My second takeaway is workflow is key. I think for workflow, we have to understand what that process is, what goal we're trying to accomplish, and making sure that you have the right stakeholders at the table and that everybody is working together towards a common goal, and you include them early and you include them often. I think you're going to find success in whatever you're trying to accomplish. If you leave those key players out, you're going to struggle, and you're going to end up redoing workflows and having a bad rollout maybe of something. So I think workflow would be my number two. Last, I think a great project manager is key, right? I don't know that we give them enough credit. I think a great project manager for me is like a great charge nurse on the unit. I'll admit, I came into IT. I was a nurse. I didn't understand how projects worked and workflows and what a project manager was. I quickly learned how key their role is in ensuring that everybody's where they need to be, the flow is working. And it's just like a charge nurse, right? Who, you know, that there's a full moon outside and it's going to be a busy night. And, you know, what chaos might come through our door. Well, if this awesome charge nurse is there, it's going to make things run smoothly. So for me, I think having a great project manager is key to a successful project.
Yeah, no, these are new like outlooks that I haven't really heard in the past. Like the
Yeah.
stakeholders, everyone really talks about is
Yeah.
having them at the table and early to ensure a rollout that's, practical and doesn't, you don't have to go back and forth all the time. But definitely good takeaways, which
Yeah.
actually leads me to my next question. As a leader and clinician, with your background as a nurse, how do you approach like the challenges that arise in the IT department? Maybe give us like, again, 2 to 3 challenges, and then what strategies can you share with the audience to help overcome them?
Yeah. I stay calm. Let's say you have an unplanned downtime, right? That's all of our nightmare that nobody wants to deal with, but you have to deal with it. So this is my code blue. I stay calm. You run the code, right? You assess, you move quickly, you work as a team, all working towards a common goal. Everybody should understand their roles, what they should be doing, and work towards that goal together of putting the pieces back together. So I think staying calm is key. And then lessons learned. I want to have a debrief like right after we have an event, just as you would in a code blue. What did we do well? What could we do better? Are there any opportunities there? I think that's always key. And I've taken that with me from the bedside over to my career in the IT world. I would say my strategy is honestly to be myself. As a NICU nurse, I deal with people with empathy and kindness. That was key in the NICU in dealing with difficult situations, in dealing with difficult providers sometimes, in dealing with different teams. And I think that truly translates well over to the IT space. I would say dealing with people with empathy and kindness is probably my strategy. I be myself. It's something that you do in the NICU, right? You're dealing with difficult situations. I'm dealing with difficult maybe providers, with family members. Um, and it's not always easy. So no matter what situation that you're in, dealing with people with empathy and kindness. So if I'm working on a project or I'm talking to the board or I'm talking to our leadership here or I'm talking to my teams, no matter who I deal with, I think I deal with them in a different way as I've been there, I've walked in their shoes before, and I'm kind, I'm a partner, and I'm going to get things done with them as their partner, not working against them.
I love that. I'm
Yeah.
all about killing people with kindness,
Yes,
not
yes,
really killing them, of course.
yes, yeah, right, right, right. Yeah, yeah.
And so I wonder if this also melds into your emphasis on the importance of like a strong
Mm,
foundation in training.
yes.
So we spoke offline, obviously, about like the importance of training end users. Can you explain why you find this so important, and how do you also ensure that the end users are adequately trained?
Absolutely. So, I think this again, it goes back to the bedside. You know, as a bedside nurse, I trained new parents at the bedside, or I did classroom training to teach them how to take care of their baby. I was a neonatal resuscitation instructor, so dealing with code scenarios, teaching people how to manage those situations, to be calm. What is your role? And I would say, well, I also mentored new nurses and I was a preceptor to new nurses. So, with that, you have to have a strong foundation. So, I've been that end user that went through a crash course of very basics and then said, well, there you go. Go take care of your patients. This is what you're going to do now. And I'll tell you, it's not a good use of our time and it just doesn't work. So I think for us, we need to make sure that we teach workflows that are meaningful. And to do that, you have to have meaningful content that is up to date. So as I was able to grow in my career, I was able to partner with our education team and really work on our training environments together and having the clinicians at the table with those that are doing the work behind the scenes to make sure that the training that we were developing and the workflows were up to date and they had what they needed so that they could run real life scenarios with new nurses as they're coming in and give them the best foundation and the best start so that they can truly focus on their patients. Now, with our physicians, we of course deal with them a little bit differently. They get that one-to-one white glove kind of service, that support. So we like to sit them down. We go through scenarios with them. We always have patients that are kind of built up that meet their needs with whatever their specialty is. So it makes sense to them. You, of course, go over the common, this is what each icon does, and the different workflows, and here's all the cool, fun tools that you get to use. I think giving them the opportunity to practice, to ask questions, and then to follow up and be there at the elbow whenever they do their first day in the clinic or their first shift in the ER or their first time rounding with patients. We're really good about, if it's a night shift, somebody's coming in and going to sit at your elbow with you, and we're going to make sure that you're successful and that you can care for your patients and not worry about this. I'll be here to answer your questions. Same thing, if it's their first time rounding, let us know when you're going to be here. If it's a Saturday, great. We're going to be there on that Saturday and we're going to round with you to make sure that you can do your work and get everything done. And then as they kind of wean off of that, they have a support line that they can call and just ensure that, somebody's there to answer questions, if they forget how to do something or, we can quickly answer those questions for them. So I think making sure that the content is meaningful and that you have that partnership with whoever is doing the training and your applications team, I think that those are the key things to making sure that we set our users up for success.
Well, I would definitely want to be a physician in your organization because I know that, some of them are just dealing with the technology and the new applications, and they're really having frustrations, like in addition to what they actually have to do on a daily basis. So it's almost like this added barrier of complications that aren't necessarily like they don't have to actually be there. And with such support that you're offering, you kind of see the challenges ahead of time and bring the solutions in ahead of time before they run into those challenges. I think that's admirable. And that's like taking the next step. And you mentioned up to date a lot. So can you put that, like break that down into practical terms? Like how do you really stay up to date?
Yeah. So we actually do quarterly updates now. When I first took over as the manager of the acute care areas and all the applications, we were doing train updates only with version upgrades, big version upgrades. So that was a big change that we had in that we do quarterly updates now. We work side by side with the education team, those that are doing the training and the electronic record. And we ensure that any new content has been put in, any new scenarios, new patients, anything that they're going to need to make sure that they can, maybe they're doing chemo training and we want to make sure that all the equipment works and you can actually scan your drugs and do real life scenarios as you're training that new nurse. So I think that refresh of the system and always adding new to make sure that it's like for like has been key so that when they go out there, it's going to look just like it did when they were in their training environment.
I can't help but ask you a bit about AI, automation, ChatGPT, obviously, but more automation, just, Hyro, we're AI assistants for healthcare systems. And so automated call centers, web assistants, refilling prescriptions in an automated way. What are your thoughts as far as like, you are the decision maker, you are hearing about AI and automation. How does that meet you? Like, are you hesitant? Are you feeling pushback internally from incorporating that? Like, how are you experiencing that?
So I have to say that my CEO is very excited about AI. So is one of our IT physician leaders, very excited about AI. We talk about it a lot. Getting there is our goal. We've still got some key things that we need to accomplish here in the organization before we can do some of that fun stuff. But I think they're all on board. This is something that we all want to move forward with. We want to give the tools to our providers and try to take the burden away, right? I mean, burnout is real. It's touching us in every way, and anything that we can do to help them, I think is going to be key. So definitely, I was talking with a board member not long ago, and he's so excited about the possibilities and what we could do with the future and technology. So I think I've got their support. It's just going to be the journey to get there for sure.
Right, for sure. Yeah, we like to call it, like whether Hyro or any other company, kind of like an added digital workforce, like another digital employee adding to the mix. really not there to replace humans, but to relieve the burden off the staff that's already overwhelmed and burnt out and doesn't necessarily have to be dealing with repetitive tasks
Exactly.
that the AI assistant can take on, and even provide like analytical data and insights afterwards, what patients are looking for, all that good stuff. So it's just interesting to hear digital healthcare executives like yourself kind of how that meets them and when they expect to implement that, because obviously there's a lot to consider before rolling that out.
There
For
is.
sure.
There is. It's going to be a fun journey. I think we've got a fun road ahead of us.
Very cool. And Gretchen, lastly, I want to hear your thoughts on when I have you back here in hopefully next year and we see you at Vive and all that good stuff. But my question is more about like the next 5 to 10 years in healthcare tech. What do you think we'll be seeing more of? How do you see it evolving in the next 5 to 10 years?
Well, I think we just touched on it a little bit, but I think it's exciting, right? As a clinician, I want to get back to taking care of my patients. So how are we going to do that? We're going to do it with automation, AI, and machine learning. I think that if we use those tools, we're going to get back there and we're going to let our clinicians work at top of license and take care of their patients. I think that the technology has brought the big data and the safety aspect, right? So I think that we've got that we still want to hang on to and utilize and maximize its potential. But let's take these new tools and let's take some of those burdensome administrative tasks and extra clicks and all of those things that we're having to do, and let's take those away from our clinicians' hands and let them get back to the basics of doing what they love, what they came to do, what they studied to do, and what their passion is, which is taking care of their patients. So what I see and what I hope to see in 5 to 10 years is that we get back there to that patient-centered, it's all about them. Let me focus, let me take care of my patients, and let all this technology help me do all those other little things that I don't want to bother with. I want to take care of my patients.
I do want to know, when you sift through the options that exist, right? What is someone like yourself, someone in your role, what are you really looking for? Like, what's your criteria to really choose the best tool, the best AI assistant? What are some like 2 to 3 must-haves or can't-have situation?
Yeah, I think for us, we're a smaller organization, so what's gonna give us the most bang for it? What's going to do the most, what's going to automate things the most, what is going to help my providers out the most, or our patients, what can I do that's patient facing, that's going to assist them to have a better patient experience or help them be more involved in patient care. So I think looking at the opportunities that are out there, being clinician centered and patient centered, those are going to be the ones that we want to move forward with.
Got it. Okay. Yeah. Well, wishing you best of luck.
Thank you.
Is there any advice as a digital healthcare executive that you'd like to leave our audience off with as we step into these years of healthcare, technology, innovation?
I would say, don't be afraid of your nurses, right? Bring us in, bring us to the table. We might surprise you. We might be the ones that have the ideas and your clinicians, your end users, period. But welcome us, let us join you. It's been fun to come over to the IT side and to learn and to grow. And I look forward to continuing to learn and grow and to all the different opportunities that are ahead.
Amazing. Well, Gretchen, this was so much fun. We hope to see you at the next event and have you hang out with us at more and more parties and booths.
Oh, yes.
Thank you for your words of wisdom and hope to have you back soon.
Thank you. I appreciate the time.
Thank you for listening to Patient Journey Pioneers, brought to you by Hyro. Subscribe to our podcast on your favorite listening platform. See you on our next episode.